Did you know that last month a 72-year-old man was rushed to the emergency room after a seemingly pleasant family road trip? His family was shocked. He seemed fine during their 6-hour journey across state lines to visit his grandchildren. No complaints, no signs of discomfort, just a regular family outing like any other. But hours after arriving at their destination, he was doubled over in pain, unable to urinate, and battling a raging infection that could have been prevented. What happened? Could it have been avoided? The truth is, after 65, certain habits during long car trips can silently damage your prostate and urinary health, increasing the chances of serious issues like infections, bladder damage, and even emergency surgery. And the worst part? Most men don't even realize they're putting themselves at risk. In this video, we're diving into 5 critical mistakes elderly men make during long trips that can seriously harm their prostate health. These might seem like small, insignificant choices, but they can have profound impacts on your well-being and quality of life. Some of them may surprise you, while others might be habits you've maintained for decades without giving them a second thought. By the end of this video, you'll have the knowledge you need to protect your prostate, improve your urinary health, and travel comfortably without putting yourself at risk. Stay with me until the very end, because the 5th mistake is something that nearly every senior man unknowingly does during road trips, and it could be setting them up for a medical emergency. Don't miss the final insight. It's one that most people overlook, yet it holds incredible power in predicting what lies ahead. These markers could completely reshape how you see your future and add valuable years to your life. If this has sparked your interest, show your support by hitting the like button, subscribing to our channel, and sharing this video with those you care about. Together, let us make informed choices for a healthier, longer life. You'll also learn what you can do instead to ensure safer, healthier travels. Now let us get started. Number 1. Avoiding regular bathroom breaks. One of the most common yet dangerous habits men over 65 develop during long trips is deliberately avoiding bathroom breaks. You might think it's harmless. Maybe you don't want to inconvenience others by asking to stop, or perhaps you are proud of your ability to hold it like you did when you were younger. But as we age, our bodies don't function the same way they used to. Think about it. When you were in your 30s or 40s, you could probably hold your urine for hours without any issues. But now, after 65, your prostate has likely enlarged, a condition called benign prostatic hyperplasia, BPH, that affects nearly 90% of men by age 80. This enlarged prostate already puts pressure on your bladder and urethra, making urination more difficult and frequent. When you deliberately avoid urinating, you're essentially forcing your already strained bladder to work overtime. This creates a dangerous chain reaction in your body. Your bladder stretches beyond its normal capacity, the muscles weaken over time, and urine can back up toward your kidneys, potentially causing damage to your entire urinary system. Consider John, a 70-year-old retired teacher who never wanted to bother his son during their monthly 4-hour drives to visit family. John would deliberately limit his fluid intake the day before and morning of travel. He would ignore his body's signals to urinate, often going the entire journey without a single bathroom break. He took pride in this ability until he developed a severe urinary tract infection that spread to his kidneys, resulting in a week-long hospitalization. What John didn't realize was that holding urine for extended periods allows bacteria to multiply in stagnant urine. His bladder never completely emptied, creating the perfect environment for infection. Over time, this habit also weakened his bladder muscles, making it harder for him to fully empty his bladder even when he did use the restroom. Here is what happens when you repeatedly hold your urine for too long. Instead of your bladder functioning normally, it becomes overstretched and loses its elasticity. The signals between your bladder and brain become confused, sometimes leading to incontinence or the inability to urinate at all, both serious conditions that can significantly impact your quality of life. So what should you do instead? Plan regular bathroom breaks every 2 to 3 hours during long trips, regardless of whether you feel the urge to go. This maintains healthy bladder function and prevents unnecessary strain on your prostate. Don't be embarrassed to ask the driver to stop. Your health is worth more than saving a few minutes on the road. Remember, it is not just about comfort. It is about preventing potentially serious medical issues that could require hospitalization. Number 2. Severely limiting fluid intake. The second dangerous habit many elderly men develop is drastically reducing their fluid intake before and during long trips. It seems logical. Drink less, urinate less, make fewer stops. But this approach can lead to serious health complications that far outweigh the convenience of fewer bathroom breaks. As we age, our bodies actually need more consistent hydration, not less. Proper hydration helps flush bacteria from your urinary tract, maintains kidney function, and keeps your prostate healthy. When you deliberately dehydrate yourself, your urine becomes concentrated, more acidic, and irritating to your entire urinary system. Think about Robert, a 68-year-old who prided himself on being a low-maintenance passenger during his family's annual summer road trip. The day before traveling, he would stop drinking fluids after 5 p.m. On travel days, he'd delimit himself to just a few sips of water, despite the journey lasting over 8 hours. After several years of this routine, Robert developed chronic urinary tract infections, painful kidney stones, and eventually, prostate inflammation that required ongoing medical treatment. Here's what happens when you routinely dehydrate yourself. Without adequate fluids, your body produces less urine, but what it does produce is highly concentrated with waste products. This concentrated urine irritates the lining of your bladder and urethra, making them more susceptible to infection. It also creates the perfect environment for kidney stones to form, which can cause excruciating pain and often require medical intervention. For men with prostate issues, dehydration is particularly dangerous. The prostate gland requires proper hydration to function correctly and fight off inflammation and infection. When you've dehydrated, you've essentially creating a perfect storm for prostate problems to develop or worsen. Beyond urinary and prostate health, severe dehydration affects your entire body. It can cause confusion, dizziness, rapid heartbeat, and extreme fatigue, all particularly dangerous for elderly individuals. It also increases the risk of blood clots during long periods of sitting, like on a road trip, potentially leading to life-threatening conditions like deep vein thrombosis. So what's the right approach? Instead of limiting fluids, maintain proper hydration while planning strategic bathroom breaks. Drink water consistently throughout the day, aiming for about 6 to 8 glasses total. For better management during trips, spread your hydration evenly throughout the day, rather than consuming large amounts at once. Consider using an app or setting alarms to remind yourself to take small sips regularly rather than drinking large amounts infrequently. This helps maintain hydration while reducing urgent bathroom needs. Avoid caffeine and alcohol before and during travel, as these act as diuretics and can irritate your bladder and prostate. If you are still watching this video and finding these insights valuable, please comment number 2 below to let me know you here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating helpful content to inform and inspire you. Now let us move forward. Number 3. Sitting in one position for too long. The third mistake that many elderly men make during long journeys is sitting completely still for extended periods. You might think that staying put and not moving around is being considerate to others in the vehicle, but prolonged immobility creates serious problems for your prostate and overall health. As men age, the prostate becomes more sensitive to pressure and restricted blood flow. When you sit in one position for hours without shifting, standing, or stretching, blood circulation to your pelvic region becomes compromised. This reduced blood flow can worsen prostate inflammation, aggravate existing BPH symptoms, and even contribute to prostatitis, a painful inflammation of the prostate gland. Consider William, a 73-year-old who took pride in being an easy passenger during his daughter's monthly 6-hour drives to visit relatives. He would sit perfectly still in the passenger seat, rarely adjusting his position and never asking to stop for stretch breaks. After months of these trips, William began experiencing increasing prostate pain, difficulty urinating, and eventually developed chronic pelvic pain syndrome, which significantly impacted his quality of life. What William did not realize was that prolonged sitting creates direct pressure on the prostate and surrounding tissues. The human body isn't designed to remain completely stationary for hours. When you sit without movement, blood pools in your pelvic region, and pressure increases on your prostate gland. This pressure can cause inflammation and worsen existing urinary symptoms like weak flow, frequency, and urgency. Moreover, staying in one position for too long increases your risk of deep vein thrombosis, DVT, potentially life-threatening blood clots that typically form in the legs during periods of immobility. These clots can break loose and travel to the lungs, causing a pulmonary embolism, which requires immediate emergency care. The problem goes beyond just sitting still. The vibration from the moving vehicle actually compounds the issue, creating micro-traumas to the prostate tissue over time. This continuous, gentle trauma can lead to increased inflammation and pain that might not be immediately noticeable, but accumulates with each trip. So what should you do instead? Make movement a priority during long journeys. Even in the confined space of a vehicle, you can perform small movements to improve circulation. Try shifting your weight from side to side every 15-20 minutes, performing gentle pelvic tilts or doing seated leg lifts and ankle rotations to promote blood flow. Plan to stop every 1-2 hours for a brief 5-minute walk. These short breaks make a tremendous difference in reducing prostate pressure and improving overall circulation. If you are uncomfortable asking for frequent stops, frame it as beneficial for everyone in the vehicle. Because truthfully, all passengers benefit from these movement breaks, regardless of age or gender. While seated, use a cushion specifically designed to reduce pressure on the prostate and pelvic floor. These cushions, which have a center cutout or are shaped to redistribute weight away from the prostate, can significantly reduce discomfort during long rides. Remember, maintaining blood flow and reducing pressure on your prostate is not just about comfort. It is about preventing serious health issues that could develop into chronic conditions requiring ongoing medical intervention. Number 4. Ignoring urinary urgency and frequency. The fourth critical mistake many elderly men make during long trips is ignoring or dismissing changes in their urinary patterns. When you notice increased urgency, frequency, or discomfort, but choose to tough it out rather than seeking help, you could be overlooking early warning signs of serious prostate issues. As men age, many accept urinary changes as an inevitable part of getting older, but not all changes are normal or benign. Sudden increases in urgency, burning sensations, or difficulty starting or stopping your urine stream, especially during or after travel, can indicate an infection, prostate inflammation, or even more serious conditions that require prompt medical attention. Consider Thomas, a 76-year-old who noticed he suddenly needed to urinate much more frequently during a cross-country road trip with his son's family. Instead of mentioning it, he felt embarrassed and didn't want to make a fuss. He dismissed the mild burning sensation as simply a result of holding his urine too long. By the time they reached their destination 3 days later, Thomas was experiencing severe pain, fever, and was unable to urinate at all. He required emergency catheterization and was hospitalized for acute urinary retention and a severe prostate infection that had spread to his bloodstream. What Thomas didn't realize was that his initial symptoms, increased frequency and mild discomfort, were his body's early warning signals that something was wrong. By ignoring these signs, he allowed a treatable condition to progress to a life-threatening emergency. Here's what happens when you ignore these urinary changes. A minor irritation or infection can quickly escalate when combined with inadequate hydration, infrequent bathroom breaks, and prolonged sitting. The infection can spread from the urethra to the bladder, prostate, and eventually the kidneys or bloodstream. What might have required a simple antibiotic initially can develop into a condition requiring hospitalization, intravenous antibiotics, or even surgery. For men with enlarged prostates, the stakes are even higher. The prostate can swell further in response to infection or irritation, potentially blocking urine flow completely. This condition, called acute urinary retention, is extremely painful and requires immediate emergency treatment, including catheterization and sometimes hospitalization. So what should you do instead? First and foremost, pay attention to your body's signals. Any change in your normal urinary pattern deserves attention, not dismissal. If you notice increased frequency, urgency, discomfort, or changes in your urine stream during travel, don't wait to see if it resolves on its own, particularly if symptoms worsen. or if you develop fever, chills, or significant pain. Pack appropriate medications if you have known prostate conditions. If you take medications for BPH or overactive bladder, make sure they are easily accessible during your journey, and stick to your regular dosing schedule even while traveling. Consider keeping a simple symptom diary during longer trips. Note any changes in urinary patterns, discomfort levels, or fluid intake. This information can be invaluable if you need to consult with a healthcare provider. Most importantly, overcome any embarrassment about discussing urinary or prostate issues. Your health is far more important than momentary discomfort from bringing up the subject. Remember that healthcare providers address these concerns every day, and early intervention almost always results in simpler treatment and better outcomes. If you were still watching this video and finding these insights valuable, please comment number 4 down below to let me know you done here, and if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating helpful content to inform and inspire you. Now, let us move forward to our final and perhaps most important point. Number 5. Being too embarrassed to communicate needs. The fifth and perhaps most dangerous mistake elderly men make during long trips is allowing embarrassment to override their health needs. This communication barrier, the unwillingness to speak up about needing bathroom breaks or discussing urinary discomfort, is particularly common among men of the older generation who were raised to be stoic and not complain about bodily functions. This hesitation to communicate can have serious, sometimes life-threatening consequences. When you are uncomfortable speaking up about your needs, you are more likely to engage in all the previous risky behaviors we've discussed. Holding urine too long, limiting fluids, remaining immobile, and ignoring warning signs of problems. Consider James, a 79-year-old traveling with his adult children and teenage grandchildren. Despite having an enlarged prostate that required him to urinate frequently, James was mortified at the thought of asking his grandson to pull over, yet again, for what he considered an embarrassing reason. Instead of communicating his needs, he suffered in silence, growing increasingly uncomfortable and anxious as the journey progressed. By evening, James was in acute urinary retention, requiring an emergency room visit that disrupted the family vacation entirely. The irony is that what James feared, being a burden or embarrassment to his family, became a much bigger issue precisely because he didn't speak up earlier. What could have been managed with simple, planned bathroom breaks instead became a medical emergency requiring hospital intervention. Here is what happens when embarrassment prevents proper communication. Anxiety about speaking up actually makes urinary urgency worse, creating a vicious cycle. The stress hormones released when you are anxious can irritate your bladder and prostate further, increasing the very symptoms you are trying to hide. Additionally, family members or travel companions remain unaware of your needs, making it impossible for them to help accommodate you. The psychological burden of this silence is significant as well. Instead of enjoying the journey and family time, you become preoccupied with hiding your discomfort, calculating distances to the next possible restroom, or worrying about having an accident. This anxiety transforms what should be a pleasant experience into an ordeal to be endured. So what is the better approach? Start by having a brief, matter-of-fact conversation before the trip begins. You don't need to share detailed medical information, simply stating, "I'll need to take regular bathroom breaks about every 2 hours," sets appropriate expectations without requiring lengthy explanations. Use straightforward, non-apologetic language when needs arise during the journey. "We need to stop at the next rest area" is clear and doesn't require justification. Remember that bodily functions are universal human experiences. There is nothing shameful about needing to use the restroom. If you read traveling with family, remember that your well-being matters to them. By communicating clearly, you actually reducing worry and preventing more serious disruptions that could occur if your condition worsens. Most family members would much prefer making brief, planned stops than dealing with a medical emergency. For those who still find direct communication difficult, consider using technology or code words as an alternative. A simple text message to the driver or a predetermined phrase can signal your needs without drawing attention from everyone in the vehicle. Remember that proper communication isn't just about immediate comfort. It is about protecting your long-term health. The temporary discomfort of speaking up is far preferable to the potential complications of ignoring your body undressed needs. We've covered 5 critical mistakes that can put your prostate health at risk during long trips. Avoiding regular bathroom breaks, severely limiting fluid intake, sitting in one position too long, ignoring changes in urinary patterns, and being too embarrassed to communicate your needs. These might seem like small, insignificant choices in the moment, but they can have serious lasting impacts on your prostate health, urinary function, and overall quality of life. The good news? These risks are inevitable. By making small, mindful adjustments to your travel habits, you can protect your prostate, maintain your urinary health, and actually enjoy your journeys more fully. Take a moment to reflect on your own travel routines. Do you recognize any of these habits in yourself? Do you tend to hold it rather than ask to stop? Do you limit fluids before long drives? Have you been dismissing urinary changes as just part of getting older? Whatever habits you've developed, know that it is never too late to make positive changes. Your prostate health isn't determined by your age alone, but by the choices you make every day, including how you manage long-distance travel. So here's my challenge to you. On your next journey, choose one of these areas to improve. Maybe you will plan regular bathroom breaks before the trip begins. Perhaps you will stay properly hydrated while traveling. Or possibly, and this might be the most challenging but most important, you'll practice speaking up clearly about your needs without embarrassment or apology. Even small changes can make a significant difference in protecting your prostate health. Remember, the goal is not just avoiding problems. It is maintaining your independence, comfort, and ability to enjoy travel experiences fully for years to come. Thank you for joining us today. We'd love to hear from you. Leave a comment below sharing one thing you learned today and how you plan to apply it on your next trip. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating quality content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.